Pregnancy Part 1. So I titled it Pregnancy Part 1. Ooh, looks like some gifts for the babies here. Okay. Let's start with this guy. So OB episodes. It is very important that we learn or we understand this different episodes when we're coding OB cases. Okay, and what are these episodes? So number one here, prenatal. What is prenatal? This is entire gestational period prior to delivery. Meaning to say the whole time that the patient is pregnant, the mom is pregnant, we call that gestational period. Okay, that's prenatal, meaning before the delivery. Of course, delivery is when there's a childbirth that occurs. That's delivery. Well, you guys know that already, right? Now, another episode is postpartum. Postpartum is day after delivery and usually lasts 6 to 8 weeks later after the delivery. And last one is puerperium. I hope I pronounced that okay, right? Puerperium, which is the period of adjustment after childbirth, during which the mother's reproductive system returns to its normal pre-pregnant state. That means to say that everything had already returned to its rightful places. That's what Britannica had identified or defined this puerperium period. Okay, so let's go to the board, guys. What are these different episodes that you guys need to understand? What I'm trying to establish here, guys, when you're coding OB cases, you have to, these are the basic, say, parameters that you guys need to understand first. So what are those? OB episodes. Know if it is prenatal or is it during delivery or is it, are you coding for a condition that is postpartum, which, a day after delivery and usually lasts up to 6 to 8 weeks, or is it around, the period where the mom is adjusting to her new condition, which is, of course, having a child now, having a baby, and during those time where these adjustments are taking place, if there are conditions that occur during this period, then that's what we call puerperium conditions. Okay, so I hope we're clear with that, guys, because when we look for codes for these OB conditions, guys, and we look for a condition that is appropriate for delivery, and we're looking for prenatal, then we're lost, right? So that's what I meant about you need to understand first the basic parameters in assigning codes for COBE. So those are the OB episodes. Again, prenatal, delivery, postpartum, and puerperium. Okay, now let's go to the next slide right here. These are the general rules for obstetric cases. Let's read. OB diagnosis codes have sequencing priority over codes from other chapters. Additional codes from other chapters may be used in conjunction with Chapter 15 codes to further specify conditions. What does this mean? It means, guys, that when you're assigning codes for OB, it is expected, okay, that you assign the OB code first before the other codes for other chapters that come along with OB. Which means to say that the sequencing, your sequencing organization should look like the OB first before the other conditions. Okay, if your code does not start with a letter O, by the way, guys, all OB code starts with letter O. I mean, what I'm trying to say is that it's easy to remember, right? O for obstetrics, right? So if your code does not start with letter O, check it again, because you might be assigning a code that's not an OB case. Okay, so general rule, the OB codes always take priority in the sequencing. Okay, the assignment of the OB codes, guys, is very different from the other diagnosis codes from other chapters. Very different. Usually what we do in looking for the code for this conditions, guys, we go straight to the condition, right? We look for the term and we go straight to the condition. But the OB cases, what the process is different. You got to go to pregnancy first or go to the delivery first before you look for that complication. So what I mean to say is that, let's say, for instance, we're looking for a code for, just to give you guys an illustration, let's say, for instance, we're looking for a code for all of a sudden I can't think of an OB condition. Okay, so let's say, for example, we're looking for the code for hypertension. Okay. What we do in the regular coding, guys, we go to the term hypertension, correct? So in OB, it's different. What you do is you go to pregnancy first. Okay. When you're looking for the code for this hypertension, you go to pregnancy. I'm talking about how you navigate your book, and then look for complicated by. Okay. Pregnancy complicated by, and then you have the hypertension here. Okay, so that's how you do it. Now we're looking for delivery. Let's say, for example, patient had delivered a baby. Okay, and because of that delivery, patient now suffered a perineal laceration. So what do? You go to delivery. Okay, complicated by laceration. Okay, so that's how you do it. You don't go to the term right away. You got to go through this process first. Does that make sense? So that's how you look for a condition using your book for this different terminologies or different complications that that are involved in pregnancy. Okay, so that's your one of the general rules in assigning code for OB cases. Now, next, trimesters. Let's read these guys. Majority of the pregnancy codes have a final character indicating the trimester. If trimester is not a component of a code, it is because the condition always occurs in a specific trimester, or the concept of trimester pregnancy is not applicable. Each category that includes codes for trimester has a code for unspecified trimester. The unspecified trimester code should rarely be used, such as when the documentation in the record is insufficient to determine the trimester, and it is not possible to obtain the clarification. So, ladies, I know moms, you are very familiar with this term here. When we talk about trimesters, you guys, or you ladies, or you moms, know this very well. So, in assigning codes for OB cases, guys, most or many of the OB codes, guys, have the component of trimesters. And what are those trimesters? So for those that are not familiar, especially single men, you haven't heard about trimester yet, or single ladies haven't heard about trimester yet. When they talk about trimesters, we're talking about the number of weeks that a patient is currently pregnant at the moment. Okay, so when you talk about trimester, okay, there's something that's called first, second, third. Okay, the first trimester is week 1 to week 12. Okay, so the first 12 weeks, that is your first trimester. The second trimester is week 13 to week 26. Okay, and the third, of course, is starts from week 27 to delivery. Okay, anything after week 26 is the third trimester. Now, what the guidelines are trying to tell us is that many of these OB codes, guys, okay, let me step on the side here so you guys can screenshot it. Many of the OB codes have the component of trimester, which means that if the condition occurs in a specific trimester, usually the last character depicts, okay, or shows the trimester that the patient is currently in. Let's say, for instance, patient developed diabetes on the second trimester. The last digit of the code will have the second trimester reflecting that, the condition reflecting that second trimester. Say, for instance, patient became or developed, say, respiratory condition. I'm not so sure if those codes, guys, will have those trimesters. What I'm trying to say is that there are conditions that you would see in OB cases, guys, that the last character will tell you which one or which trimester that the patient is currently in, being pregnant. Does that make sense? Okay, so know your trimesters, because this is very important. Now, the guidelines also mention that there are codes that trimesters are not applicable, simply because that those codes or the trimesters are not should not be part of that code, because they're not say significant, or they're not applicable to that specific condition. And also the guidelines are trying to tell us that sometimes, very rarely, that the doctor will not document a trimester. Any good OB doctor will have to document the trimester, whether the patient is on the 26 weeks of gestation, whether the patient is on the 15 weeks of being pregnant, or 6 weeks or 8 weeks, because these gestational weeks, guys, are very important in taking care of the patient and looking after the patient. So very rarely that a trimester is not documented. But in the case of the doctor forgets, did not document the trimester, there is actually a code for unspecified trimester. Any question, guys? So we're good? Now we're still in the general parameters, general guidelines of OB coding, guys, for us to be able to at least have a very good concept of what OB, why did I say Kobe? What OB cases look like in terms of diagnosis codes. Okay, so we have the trimesters. Then let's go look at this one. 7 character as fetus identifier. Okay, let's read this, guys. Okay, assign 7 character. Okay, 0 for single gestations when the documentation in the record is insufficient to determine the fetus affected and is not possible to obtain clarification. When it is not possible to clinically determine which fetus is affected. Before we even expound this guideline here, guys, let me explain to you what a 7 character in terms of OB cases. We now know that ICD-10-CM, guys, can expand to 7 character long, right? Now in OB rules or OB coding guidelines, the 7 character is the fetus identifier. What I mean by fetus identifier is that if for some reason patient has multiple gestations means patient may be carrying twins, triplets, quadruplets. Have you guys heard about Octomom? You guys heard about Octomom, right? So she had 8 babies. I don't know what happened to are they all grown? They should be all grown up now, right? The babies, those 8 babies. So imagine that you're dealing with cases, or you're reviewing a chart of a mom who has like multiple gestations, multiple fetuses. Now the guidelines about 7 characters says the 7 character should identify which fetus is affected or having a complication. Let's say, for instance, mom is carrying twins, okay, and the second twin, it has a slow heart rate, a fetal heart rate. Okay, so in the documentation, when the OB or the doctor indicated or reported that mom checks in, and because one of the babies, the second baby, has a slow or very weak fetal heart rate. So here you go, as coder, you go look for that fetal deceleration or fetal heart rate condition and assign number 2, because the doctor said it is the second fetus, or the second, the second baby. Oh, it's not baby yet, right? It's still inside the mom's belly. So the last character, if the doctor said this is the second fetus, or the number 2 fetus is the one that has a fetal heart rate, your last character should be 2. The last character 2 is not about the number of fetuses, guys. So remember that, okay? Now, in what we just read here, you only assign 0, okay, for a single gestation. It just makes sense, right? Because you don't have to identify the fetus. So 0, the last character 0, is for single gestation, or if there was no documentation whether it is single gestation or not. So, but it's rarely, it rarely happens. Okay, so let's read again. When it is not possible to clinically determine which fetus is affected, you assign 0, which means that if a mom is carrying multiple fetuses, and the doctor is having a hard time to identify which of these fetuses is the one sick or has a complication, then you assign 0. If there was no definitive fetus identifier, you assign 0. So look here, guys. Can you guys read it? Is it readable from your end? One of the following 7 character is to be assigned to each code under category 032, which is 7 characters. 0 is for single gestation and multiple gestations where the fetus is unspecified. So you have here number 1, fetus 1, number 2, fetus 2, 3, fetus 3, 4, fetus 4, and so on and so forth. Any question or comment from this slide right here? It's pretty simple, right? I'm not saying pretty simple. It's understandable, right? Pretty clear. Okay, now let's go to the next slide. Okay, so we're talking about weeks of gestation here. Let's read what the guidelines say. By the way, guys, these slides here are straight from the guidelines. Let's read weeks of gestation. In ICD-10-CM, completed weeks of gestation refers to full weeks. For example, if the provider documents gestation at 39 weeks and 6 days, the code for 39 weeks of gestation should be assigned, as the patient has not yet reached 40 completed weeks. So you assign a code, or you assign a gestational week code for 39 weeks if the patient has not completed that 39 weeks yet. Okay. Now, when you talk about weeks of gestation, guys, there is a code for weeks of gestation. By the way, if you go to you go to your book and look for the word week, and you will see the gestation. You will see the different code ranges for different weeks. Let's say, for instance, patient is pregnant or has been pregnant for 18 weeks. You go to weeks, go to gestation, and you will find a code for that 18 weeks gestational week. Now, it is very important for doctors to know that the next user of the chart, by the way, to know whether how many weeks a patient is currently pregnant in its pregnant state, in her pregnant state. So it is very important because treatment, if there's a complication, the treatment to the patient has something to do with the gestational weeks. Most importantly, they always consider how the fetal development is transpiring. So that's the reason why the gestational weeks are really, really important to put in to reflect in the code. Okay. Any question in that with that gestational weeks, guys? Okay. Now, the next slide here. So we're good with gestational weeks, right? So what I'm trying to share with you guys for now is to kind of like prep you up before we even go to the details of the OB codes, because I want you to, when you're thinking about OB codes, guys, diagnosis codes, I want you to stay in these rules, in these parameters, in this concept, okay? Like, you know that there's trimester, you know that there's gestational weeks, you know there's an OB episode. So you got to think within those parameters. Okay, and OB codes are for use for maternal use only. Chapter 15 codes are to be used only on the maternal record, never on the record of the newborn. What does that mean, guys? Okay. The coding guidelines have to emphasize it simply because sometimes, guys, documentation of the mom and the newborn can easily get mixed up. Let's say, for instance, we're talking about outcome of delivery. So you're assigning a code for the mom's record, and you're trying to reflect or assign a code saying that mom delivered a single healthy life born. Okay, so you're talking about the mom. Now here comes the newborn with the same language, same documentation, like newborn was alive and kicking, and no complication to newborn. So it can get easily mixed up. So please remember that when you assign a code, when you're assigning the code, you want to make sure that you're assigning the code for the mom, or you're assigning the code for the baby, because when the baby comes out, how many patients you have now? If it's multiple gestations, there are multiple patients record, right? So you want to make sure that you put in the code to the right patient, to the correct patient, because sometimes they can easily mixed up in terms of documentation. Having said that, guys, let me just recap, okay? Those parameters, OB episodes, know if it is prenatal, if it's delivery, if it's postpartum, it is puerperium, okay? You got to be very certain that you are assigning a code specific to these OB episodes. You want to make sure that in sequencing, guys, your OB codes take priority. Okay, your OB codes take priority over other codes from other chapters. Consider the trimesters. You want to make sure that you're reading the chart very appropriately, very in detail, and look for that gestational weeks, and make sure that you're assigning the code in the right trimester. If the 7 character is necessary, assign that 7 character. If we're talking about complication to the fetus, make sure to assign the 7 character not as the number of gestations, but identifying which fetus is sick or which fetus has complication. And of course, the weeks of gestation can be calculated. Of course, it's always documented. Very rarely the doctor forgets that. Make sure to assign also the code for weeks of gestation. And lastly, guys, is OB code should only be assigned to the mom's chart or mom's record.